Hi, everyone, and welcome back to Health First. Today I'm here with Dr. Velayo, who is a general dentist and owner of Green Valley Smiles Dentistry. Hi, how are you?
I'm good. Thanks for having me.
Thank you so much for joining me here today. I'd like to start off by asking what influenced you to pursue a career in dentistry?
Sure. It all started when I was in high school. Growing up, you're always asked, like, what do you want to be when you grow up? And I had a really great pediatrician. And so I thought I wanted to be a pediatrician, go to medical school, follow that route. And in my sophomore year of high school, we had to do a school project where it was basically career day, and you had to present on a certain career. Part of that task involved interviewing someone from that profession. I was shy at the time, and conveniently, I had a dental appointment coming up. And so I was like, you know what, let me kill two birds with one stone. Let me just interview my family dentist, and I'll just make the whole project about dentistry. And through that, after I learned about dentistry, I love that my dentist, she was a business owner, that she was well respected in the community. I mean, I had such great rapport with her patients. And so after giving the presentation, I basically convinced myself that I should go into dentistry. And that was the seed that really planted, because as you know, because you're going through it right now, I mean, there's so much commitment, investment, so many steps along the way. And so the more that you expose yourself, then I was able to really grow my passion. And I ultimately have found that dentistry is the best profession for me.
Yeah, definitely. That's a great story. And can you tell me a little more about your profession and what you do?
Sure. So I'm a general dentist, and I'm a business owner, which is really cool. So that's honestly what I envisioned growing up as a dream, following in my family dentist's footsteps. And so day to day, as a general dentist, I really view myself as, it's equivalent to your primary care physician. This is the person that you see regularly for your overall wellness checks, general checkups. And so, as a dentist, I do a lot of exams. Okay. So, just a checkup. We start off with some x-rays, we take a look in the mouth. I talk to my patients about what their main concern is, because not everyone has the same goals. Of course, we think that the main goal is health, like, and the most common concern that patients have is, I just want a checkup and cleaning. But it's my responsibility to read the x-rays, delve deeper, ask them questions, and identify disease, right? Because oftentimes people don't realize that they may have underlying disease because, decay starts off small, or gingivitis, bleeding gums, and early stages of periodontal disease. Oftentimes, the only warning sign you'll see is just bleeding gums. Usually, and unfortunately in dentistry, things that start bothering someone, if a patient's coming in pain, usually it's too late, and that an infection has gone too far. So that's my job, to do early detection and educate the patients on what I see, give recommended treatments, and then also talk to them about how we can prevent future issues from getting worse. And then really, as a general dentist, what's great is I have the luxury that I can do whatever procedures that I feel comfortable doing. And so as the quarterback, right? So my patient's coming in and they have, let's say, really, either their main concern is they're having toothache from their wisdom teeth. If it's a difficult case that I don't feel comfortable doing, then I'm going to punt it and pass it to my oral surgeon. And so we get to work with all the different specialists, just to provide the patient the best care.
Yeah, thank you for the insight. And what do you like most about your profession?
What do I like most about my profession? I really love patient interaction. I like to joke with my patients that if I have a superpower, I think that I can help make anxious patients feel comfortable. Dentistry is with media and people's experiences, it's an misunderstood profession, or people have bad experiences with it, and so they're traumatized, and so people are not are afraid to come in, or they have this misconception that they think, dentistry is going to cause them a lot of pain. And especially if they've had bad experiences in the past. And so I love just getting to know my patients. I think that's a really great advantage of being a general dentist, is because these are patients that I can grow up with. I've seen patients start off as little kids, and now they're teenagers, they're high school, and adults that, you're seeing throughout their 30s, 40s, and 50s. I'm not that old, but I anticipate that we're going to grow together in that sense. But you can experience all of their life moments with them, like from getting married to having their first kid. And really just helping reshape the idea of what dentistry is, right? And I've found that just by getting to know the patient, treating them like a person. And I love to educate and explain, right? Like if, you are not in dental school yet, so if I'm telling you, you need scaling and root planing to treat your periodontal disease, you're probably like, what is that?
Mhm.
Right. And so you're like every other patient, they don't know what that means. And so what is the likelihood of you or the patient accepting the treatment if they don't know what that means, or how it's going to benefit them? So I love just, breaking things down. I'm sure you've seen my oral health minute videos on Instagram. And that's how I talk to my patients. I want to make things relatable, make it fun. And then they're like, oh, wow, you're cool. This isn't scary. And that wasn't so bad after all,
Yeah, definitely. That's great. And I know I love a dentist because of my dentist interaction with me and how great it is.
That's good that you have a good experience.
Yeah. And many new technological innovations have been developed in dentistry throughout the years. Have you adopted any of these innovations in your practice?
Absolutely. I mean, I feel like I entered dentistry at the right time. And I really am a firm believer that it is important to keep up with the times, because that's what patients are looking for. And all the new technologies are designed to make dental care streamlined and more comfortable for the patients. So a couple of my favorite pieces of technology in my office, I have a CAD CAM machine. I have a CEREC machine. And so back in the day, and still some dentists are doing this, you'll take a traditional goopy impression to make crowns, bridges, veneers, and then you send it to the lab, and it takes about 2 weeks for it to come back. The patient's in a temporary, they're uncomfortable, temporaries fall off. And then best case scenario, you're able to, deliver and cement that restoration the same day. What if it doesn't fit? You send it back to the lab, and it's a whole process. So by having my own CEREC machine in the office, I have a milling unit in the office, I'm able to make same day crowns, bridges, veneers for my patients, so they don't have to be in temporaries, and they can get it done in 2 hours. And so another piece of technology that I recently invested in is I have a CBCT. It's a cone beam scan 3D X-ray machine. Okay, so it's really great because I've been able to uncover different infections or pathologies or diseases in the patients that my traditional 2D X-rays maybe couldn't find. And so I'm able to help get patients definitive diagnosis and treatment faster, versus in the past, it's sort of been like, well, I understand you're in pain. This X-ray doesn't really tell me too much. And before I recommend treatment that I'm not 100% confident in, watch your symptoms for 2 weeks. If it's getting worse, come back. And so now the patient's suffering for an additional 2 weeks. The 3D X-ray has been able to help me find issues and have that confidence to diagnose, which has been really cool.
Yeah, that's amazing. And I've been researching technological innovations in dentistry, and they're incredible, and they definitely transform the field.
Absolutely.
And as you know, the COVID-19 pandemic has greatly affected the world and continues to do so. So how is it like working throughout the pandemic?
It was emotional. It was honestly, it tested my strength.
Mhm.
when the COVID-19, when the whole pandemic had hit and we had all these shutdowns in place, in my state, we were restricted to emergency dental services only.
Mhm.
And obviously we do a wide range of procedures and not everything is emergency only. And so it was sad. I was in a very difficult position. I had to, furlough or temporarily pause the employment of most of my staff. And that's hard as a business owner when you deeply care about everyone that you're working with. On top of that, then I was in a position, I'm trying to figure out, well, how am I going to survive? How am I going to make ends meet? I promised my team when I had to furlough them that I would give them a place to come back to work to. So how was I going to uphold my end of the promise? And so, it really tested my mental grit and strength because I'm just like, all right, well, I'm gonna make this work. And I was able to quickly pivot and basically market myself and my office as, let everyone in Nevada, I work in Las Vegas, so let everyone in the Valley know that I'm open. I'm here for emergency dental services. And because a lot of offices were closed and a lot of providers were afraid to work because of the unknown, right? And I had to remind myself, like, as a dentist, I am a healthcare worker. We are still frontliners, and being open to be able to help alleviate the burden off of the hospital ERs, because at the time, and still, like, they're being overloaded treating their COVID-19 patients and other patients. And patients are coming in with abscesses, dental emergencies, and those ERs are not equipped to take care of those patients. So they're wasting valuable space. The patients aren't even getting treated. So I was part of a grassroots effort to just help let everyone know, dentistry, if you're having a dental emergency, come to the office and have a dentist take care of you. So, you know, it was, we were able to pivot, and I was able to survive, and I was able to bring all of my team members back and hire more people. So, it really just goes to show that I think when you're able to put your heart in the right place and work hard and really think outside the box, and you should say, I'm going to do whatever it takes,
Mhm.
you can survive any hardship.
Yeah, definitely. And it was definitely a very difficult time. So it's great that you were able to continue providing care for those who needed it.
Absolutely. Yeah, I thought it was very important.
Mhm. And to end off, can you give a few words of advice to people hoping to pursue a career in dentistry?
Sure. I always tell students, young people who are looking to go into dentistry, you have to remind yourself it's always harder to get in. Dental school is a tough process. So don't give up. People, sometimes it takes multiple cycles. And I would say in order to strengthen your application, because that is the hardest part, once you're in dental school, luckily there are so many resources and to help you succeed. And you have to remind yourself the admissions team really saw your potential. So they're going to help support you get to the finish line. But it is a competitive field to get into. So just don't give up, don't get discouraged, and think about how you can strengthen your application and really differentiate yourself. And I really think that, I used to help as a senior in dental school. I used to help conduct the interviews for the prospective students. And, passion is undeniable. And so it's really, there is no scripted answer that someone's looking for. So don't pretend to be someone else. Think about what really makes you excited to go into the field, whether it's the technology, whether it's the ability to really help underserved populations, whatever that story is. Like I said, that passion and that energy is infectious. And those are the type of people we want to see enter the field, because we want to know people's hearts are in the right places and that they're willing to really help grow the profession. Versus, you'd be surprised how many people I talk to on how they ended up in dental school, and they'll say it's because I didn't get into medical school. That's not the right answer, right? Like, how passionate are you about that? Or it's because, oh, my mom's a dentist, my dad's a dentist. How is that showing your passion other than you feel like you're being forced into the field? So think about that. And I think the only way you can really discover your passion is just, again, exposing yourself, attending, webinars like this, shadowing doctors, and what other events they have in your school that, allow you to learn more about dentistry.
Yeah, definitely. Thank you so much for the great advice. And those are all the questions. So thank you for joining me and thank you for your time.
Thank you. And if you have any questions, please don't hesitate to reach out to me. You can follow me on Instagram at Dr. Bianca Velayo, and you can message me, and I'm happy to continue to share my experiences with you.
Thank you so much. Have a great day.
Have a good